Bismillah ar-Rahman ar-Rahim, my dear students of Ajman University, College of Pharmacy and Health Sciences, second year students for the course Pharmaceutical Dosage Forms 1. This is the last topic among the 4 topics that we discussed. This topic is entitled Suppositories. Now, as usual, we will start talking about the learning objectives. Here, we are discussing the things that you should be able to answer or do by the end of this topic. First of all, you should be able to compare between different suppositories dosage forms. There are different suppositories types, and they differ in their size, physical appearance, shape. We will discuss these types and their physical appearance, and you should be able to differentiate between these types. Also, we will focus on the rectal drug delivery of medication or of drugs using suppositories, and therefore we need to list the advantages and disadvantages in comparison to oral drug delivery. The third outcome of this topic is to identify and explain physiological factors that will influence or will affect drug absorption from rectal suppositories. Yani, what I mean here is, what are the things that affect the drug release from the suppository and its absorption? Okay, physiologically, what are the physiological factors? In a similar way, we want to talk about also the physicochemical factors. طبعا, what is the difference between physiological factors and physicochemical factors? Physiological factors is to do with the rectum physiology. Yani, for example, what is the pH of the rectum? What is the buffer capacity? Is there stool in the rectum or in the colon? These are the physiological things. Physicochemical factors are related to the suppository itself. And you should know that suppositories are made of vehicle, and here we call it the base, that carries the drug. Yani, we have two main things here, with the base and the drug. So we want to talk about the physicochemical factors of these two main constituents. Another thing is we want to talk about the base. Usually the base makes most of the suppository. Yani, most of the weight is the weight of the base, which carries the drug. It's very similar to ointments and creams. In ointments and creams, medicated ones, the ones that have medicine in them, most of the cream or ointment is made of base that carries the drug. So this base is very important because it affects the release of the drug from the base. Yani, the base that we use has an effect on drug release from suppository. Also, you should be able to list, discuss, and explain the 3 methods for preparing suppositories. Also, you should be able to counsel patients as a pharmacist. You should be able to counsel patients on important points regarding storing, regarding administering the suppository. The last thing is determine the density factor of a drug in a suppository base such as polyethylene glycol. Now, polyethylene glycol, اللي هو PEG, is a suppository base, and in order to prepare a drug in such bases, we need to know the density factor of the drug. Now, I will not talk here or discuss how do you calculate the density factor. Maybe you will have this in the lab, but you'll be given density factor of a drug in a base, and then based on that you'll be calculating the amounts of the base and the drug to be used in order to prepare suppositories. يعني if I want to prepare suppositories, whether using molding method or using compression, later we will talk about these methods, you should already know what is the density factor of the drug in the base. Once you know, you'll be able to calculate the quantities of the base to be used and the quantity of the drug. So I will not talk about how to calculate density factor. I will talk about, once you are given the density factor, how can you calculate the amount of base and the amount of drug to be used, because it's one of the problems or the challenges that we will face when we prepare suppositories. We will talk about this, of course, later in more details. Okay, so how do you define suppositories? Because we always, after talking about the course learning outcomes, we talk about the definition of the dosage form. Now, what is suppositories? Now, in similar way in which we define tablets and we define capsules, we are going to define suppositories. Suppositories are defined as unit solid dosage forms. Again, here you will see unit because each suppository consists of a dose of a drug, so we call it unit. بعدين solid dosage form, this is how the suppository state of material is a solid. Now, just by saying unit solid dosage form, you still don't have the full idea or the full picture of this dosage form, because tablet can be unit solid dosage form, capsule can be unit solid dosage form. Now, it becomes more clear when we say what is it intended for and what will happen. Now, suppositories are intended for insertion into body cavities or orifices. Now you can think of orifices. Of course, there are more than one orifice in our body, but here we are talking mainly about one, rectal, which is the most common, followed by vaginal suppositories, and rarely there is also urethral suppositories. So now we know it's solid unit solid dosage form intended for insertion into body orifices. طيب شو بصير after that؟ طبعا depending on the suppository it will melt, soften or dissolve. يعني في عنا three things that can happen to the suppository. One of three things. Okay, melts, soften, or it will dissolve. And by this happening, okay, when it melts, dissolves, etc., what will happen? It can exert, it can produce يعني local or systemic effects. طيب, the suppository, the term comes from where? It's actually a Latin word, or it comes from a Latin word اللي هي saponer. Now, what is saponer? Saponer means to place under. Okay, جاي من sub اللي هي under, وponer اللي هي to place it. طبعا here they refer to placing it in the rectum. Now, as I said previously, base is a very important part of the suppository because it will carry the drug, it will affect the release of the drug. And if we go back to the definition, we said that the suppository is maybe melting, and this happens when we are talking about fatty suppositories or oleogenous suppositories, اللي هي oily, because it will not dissolve, it will melt. Okay? And an example of oleogenous suppository اللي هي cacao butter. Cacao butter is an example. Or dissolves, disperse and dissolve, اللي هي زي for example اللي هي الwater soluble bases أو miscible bases اللي هي like glycerinated gelatin or polyethylene glycol. Okay, now طبعا the use of suppositories, as we said already, it's for ايش حكينا؟ for local or systemic action. طبعا suppositories can produce both, but it is more useful when we are talking about local action. Local action, we will talk about it later, okay? But of course it can also be used for ايش؟ for systemic effect. طيب, what is the ideal base? What the ideal base that will carry the drug? What it should be having? What are the properties of such ideal base? طبعا أكيد it should be non-toxic, because this is not allowed, it cannot be used. It should be non-irritating. يعني for example, if I insert it into the rectum, it should not irritate the rectum. Irritation will cause defecation or movement of the stool outwards, evacuation of the stool, and sometimes intentionally we do irritation to have that effect, evacuation of the stool. Otherwise, in normal cases, it should be non-toxic, non-irritant, inert. Inert يعني ايش؟ يعني it has no pharmacological effect. It's just there to carry the drug and to make a suitable dosage form as suppository. Also, it should not interact with the drug. يعني it should be compatible with the medication. Another thing which is important about suppository base, اللي هي it should help in manufacturing or producing the suppository. How it can help? By being compressible, and it can be easily compressed, or molded. طبعا these are the two main ways of producing suppositories industrially, بالindustry يعني. And the most common طبعا اللي هي molding. Okay, we will talk about these two methods later. Okay, but in any way, another property that is also important في البase is that it should melt when it's inserted into the body orifice, or it should swell to release the drug, or it should dissolve. These are the ways by which the drug can be released and by which this affects the rate and extent by which the drug is released, and therefore after that, if it is for systemic action, absorbed. Okay, let's talk about the routes of administering suppositories. طبعا these routes will influence the shape, the size, the appearance of the suppositories. So they are available in different shapes and sizes, You see here, for example, this almond or oval shape, which is suitable for vaginal administration. This one is suitable for rectal administration, or maybe it's something like that. This one is for urethral administration. We will talk about them in more details. Now, first we will talk about rectal administration of suppositories. Now, in case we are administering suppositories rectally for adults, usually the size is about 32 millimeter, let's say about 1.5 inch, but of course 1.5 inch is more than 32 millimeter. لأنه 1 inch is equal to how many millimeters do you know? You should know, okay? Now 1 inch is equal to 25 millimeter or 2.5 centimeters. طيب, it means 1.5 will be more than 37 millimeter. Okay, maybe about 38 millimeter. Okay, so it's actually less than 1.5, about, let's say, 32 millimeter. The exact size is not really very important, whether 2-3 millimeters above or less than this size. Anyway, and the shape is like a bullet. bullet اللي هو ايش؟ رصاصة. How the bullet looks like. أو التوربيدو. يعني it is something like this. This is like a torpedo, okay? Or like a bullet, like this one. Or like a little finger. يعني if you look at your small finger, it looks like the last part of your finger, okay? Now, what about the weight? طبعا the weight varies according to the base that we are using. يعني in this suppository, what is the base and how much drug is there? Okay, this will affect the weight. But for adults, it will be about 2 grams when we are using cacao butter. Now, you should remember that the other name for cacao butter is theobroma oil. اللي هي ايش؟ theobroma oil. And this is the other name for cacao butter. When we talk about children, then the size and weight is about half that of the adult. يعني this is 2 grams for adult. For children, it will be about half that weight, and it's more like pencil shape. Okay? طيب, why it is like pencil shape? To make insertion easier في pediatric population or في infants with children. Now, what you see here is an example of small scale production of suppositories. You will see here the mold. هذا الميتال الكاست اللي موجود هون. Okay, this metal is the mold, and what we do is we add the melted material in the cavities here اللي هي في المولد, and then we will be able to produce these suppositories as you see them. طبعا this method we will talk about it more in detail, but it's the molding method, and what you see here is in small scale. في large scale طبعا في industry they don't use this one, so we use it in the lab, and inshallah you will see it in your lab as well. طيب, these suppositories that are to be administered in the rectum, we already know now that the shape is a bullet or torpedo or like little finger, and we already know now the weight for adult when we are using theobroma oil or cacao butter, which is 2 grams, length 32 millimeter, infants and children maybe about half that. Now we need to know is for what purpose do we use اللي هو ايش؟ rectal suppositories. We use them for either local effect or for systemic effect. Now, when we say local effects, these can be like, for example, in the management of inflamed hemorrhoids. اوكي الهيمورويدز اللي هي البواسير. اوكي now those who have hemorrhoids they are having inflamed area, there might be bleeding, there is a lot of pain, and you need something to soothe that. Okay يلطف يعني soothe that area, especially when someone goes for defecation or for releasing the stool, it becomes even more painful. Okay really painful. So that's why you need to administer something like anti-inflammatory or and local anesthetic, something to cause less pain. Okay you don't feel a lot of pain with local anesthetic, and you want something also to ease evacuation of the stool. يعني also when the stool is released, okay when you go to the toilet you want to evacuate the bowel, you want something to make it easier for the stool to be released. So you, as I said, you take anti-inflammatory, you take local anesthetic, you may take also protectant, okay, to protect that area. طب another local effect or suppositories used for their local effect is when someone is having constipation. In this case, you want to give a laxative. Now, what laxative? Now, there are a lot of options that I will have, but one of them اللي هو suppositories. We have, and maybe you are familiar with, glycerine suppositories. Glycerine suppositories are mainly given to infants and pediatric population in order to ease or to help in evacuating this stool. أما for systemic action or activity, طبعا we may use that in cases when it will not be possible to give the medication by mouth or orally. For example, if someone is vomiting or unconscious, or maybe the drug is irritating the stomach, okay, or maybe destroyed by the stomach. In this case, you can give it by rectal administration. And example of conditions where you may give it as example of conditions which might be treated by rectal suppositories include الأسمة، nausea، الأسمة هو زي الربو، nausea اللي هي الغثيان، motion sickness اللي هي when you become dizzy, especially when you travel by airplane or by sea. كمان في عندنا الانكزايتي and bacterial infection. These are some of the conditions that can be treated by rectal suppositories. Now the question is, why rectal suppositories? Do they have a certain advantages when we use them? Yes. One advantage اللي هي avoiding first pass metabolism. Okay. Now you will learn later that the rectum has 3 veins. في عنا اللي هو الانفيريور هيمورويدال فين والميدل هيمورويدال فين والسوبيريور هيمورويدال فين. Superior hemorrhoidal vein is at the top of the rectum. Now, when you insert the suppository and this suppository release the drug to the lower or middle hemorrhoidal vein اللي هو الانفيريور أو الميدل, then the drug will go directly to the systemic circulation. But the drug that gets to the superior hemorrhoidal vein will need first to pass to the liver. So let's say it's not completely avoiding first pass metabolism, but at least reducing first pass metabolism in case some of the drug gets absorbed by superior hemorrhoidal vein. Another thing is regarding drug stability. Now, if this drug is affected by gastric juices by enzymes, then a good place to insert the drug is rectal. Also, you can insert larger dose, for example, compared to capsule and tablets, which are administered orally. Also, as I said previously, if the drug is irritating the stomach, okay, like for example aspirin, indomethacin, these medication can, in this case, be administered rectally. Also, for unpleasant tasting or smelling drugs, rectal administration will be also a good choice. Also, in case of children, okay, now children, they are known to refuse to take medication orally. They fight, okay, and if you tell them, okay, I will give you injection, they even have a greater fear to take injections. So in this case, they may be administered rectally, drug rectally. طيب, also in patients who are experiencing nausea and vomiting, so I cannot give the medication by mouth because the patient is vomiting. In this case, I can administer it rectally. Also, in case there is a problem, especially there is a disease in the upper intestinal tract, like for example, there is ulcer or a part of the stomach was removed, etc. These might affect drug absorption. So in this case, I can give the drug برضو rectally. But we talked about so many advantages, so what are the disadvantages? Now, if you are given the choice, if I ask you, would you prefer to take the drug rectally or orally? I'm sure you will choose orally because rectally is not a convenient way to administer the drug to patient. طبعا, I don't have to say that you have to go to a private place to do the procedure. Another thing regarding rectal administration, it's well known that rectal administration of the drug can result in erratic absorption of drug. Yani when I want the drug to be absorbed from suppositories, administered suppositories, according to many studies, they found that not only limited amount gets absorbed, but also the absorption is erratic. Erratic طبعا, here it means inconsistent. Yani sometimes more drug gets absorbed, sometimes less drug gets absorbed. It's not consistent. Another problem is that the suppositories might get leaked. They might get leaked from rectum, especially if the suppository is oily, or even expelled after insertion. Yani, you inserting it because you did not insert it well enough inside. طبعا, when I say well enough inside, I mean about 1 inch in adults and maybe half to 1 inch in infants and pediatric population. So in this case, it might be expelled. Okay. The second route of administration is vaginal administration. طبعا, the most common is rectal administration. Then we have vaginal administration, but of course, vaginal administration is for certain conditions. Okay, يعني it's not a substitute for rectal administration. Now, vaginal suppositories are also called, there is another term for these suppositories, اللي هي pessaries. Okay, and remember, I'm not talking here about vaginal inserts. I'm talking about vaginal suppositories. طيب, these are called pessaries. Now, their shape is globular, يعني كروي, okay, globular, oviform, يعني oval, or cone shaped, and can weigh about 5 grams when you are using cacao butter as a base. But you should know that this amount can vary considerably, يعني a lot, widely, between one manufacturer and another, and also it depends on the base that you are using. Now, the advantages of vaginal administration, here please remember that I am focusing on vaginal administration, not on administering suppositories when I say the advantages. Okay? One, the dose can be retrieved if necessary. يعني after insertion you can get the suppository that you inserted out, but actually here they mean mainly about intrauterine devices. Okay, اللي هي they are using it for contraception. يعني the woman, married women who don't want to get pregnant, they can administer اللي هو intrauterine devices as you see it here, okay, to prevent pregnancy. طبعا in this case when the woman decides that she wants to get pregnant, then she can remove it. فهنا this is what it means by it can be retrieved if necessary. Another thing اللي هو intrauterine devices can be impregnated with levonorgestrel, which is a contraceptive and also used for other purposes, okay, which can be inserted with the intrauterine devices. Okay. Now طبعا في هناك عندنا disadvantages for vaginal administration, انه it's not really the right place if I want to administer drug for systemic effect. طيب, why it's not the right place if I want to use it for systemic effect? The reason for that, إنه vagina is physiologically and anatomically dynamic organ. يعني it changes and this will cause changes in pH. Well, pH is known to be very important, or the pH known to affect drug absorption. Okay, maybe we'll talk about this later. Since it's dynamic organ, the pH changes, and not only that, but even the membrane permeability change over time. Okay, you don't forget there is the menstrual cycle. There are hormones affecting the vaginal area and even the lining of the skin in that area, and all of these things will affect the pH and the permeability. Therefore, it's not really suitable for systemic effect of the drug, or for systemic conditions or reasons. طيب, also another thing, there is also a tendency for the dosage form to be expelled after insertion into vagina. Okay? فإذا, what I mean to say here, it will be mainly used for for local effect. طبعا, in addition to suppositories اللي هي سميناها pessaries in case of vaginal administration, in addition to that, we have solutions that can be administered vaginally. We have powders for solution. شو يعني powder for solution? It means it means that you buy the powder from the pharmacy and then you add liquid to it. We have also ointments and creams. We have foams. We have tablets, اللي هي vaginal inserts. Okay? Now, the conditions that we administer the suppository for, the conditions include, for example, or the reason for administering suppositories or other dosage form even اللي هي for contraception or as a contraceptive. شو يعني contraceptive حكينا؟ to prevent pregnancy during the sexual intercourse. Also it can be used as feminine hygiene antiseptic يعني كانتيسبتيك وبنفس الوقت ايش؟ also it kills or it removes any odor, and also as antibacterial drugs like antibiotic, and also we have the antifungal drugs. طبعا in many cases, especially for married women, they may have bacterial and fungal infection in that area. And the other condition اللي هي to restore vaginal mucosa يعني when the vaginal area is dry. طب usually these suppositories اللي هي vaginal suppositories اللي هي we agreed to call it pessaries are provided along with applicator. Okay, this is the applicator. Now in the process the suppository or the pessary is loaded into the applicator. Okay, شوفوا هون في عندنا like syringe اللي هي ايش؟ plunger. Okay, so you load it into the plastic applicator and then it's inserted into the vaginal canal as deep as it can get without any pain, and then it's pushed out. شايفين هذا البلنجر؟ You can use it to push out the suppository from the plastic applicator, and then you can remove the plastic applicator. If it is for one use, then you need to throw the plastic applicator, otherwise you need to wash it and dry it. Okay? طبعا one of the problem with suppositories, especially if they are having oleaginous base like cacao butter, انه they can be messy. يعني they can leak and they can affect, for example, if someone in bed, it can affect the bed linens, and that's why the woman is advised to use it at night before they sleep, and they should wear a sanitary napkin to protect their nightwear and bed linen. طيب, the third route for administering the drug, which is rarely used, اللي هي urethral. Okay, urethral suppositories are also called buges, and this is the other name for urethral suppositories. They are cylindrical, okay, and like pencil, يعني slim, like pencil. Their diameter is from 3 to 6 millimeter. For male, it can be as long as 140 millimeter long, which is يعني 14 centimeters, and with cacao butter it can weigh about 4 grams. For female, it's half the weight and half that length. It's about 7 centimeters and can weigh 2 grams, about 2 grams with cacao butter. Now, traditionally, as I told you, now it's rarely they use such thing. Traditionally, they used such suppositories or buges as local anesthetic and antiseptic. Okay, so they used to insert it in the urethra, antiseptic and local anesthetic, for example, before making a surgery. Current days, there is, as I told you, very, very few products that are administered in the urethra. And nowadays, what we have is not really suppository, it's like a pellet. يعني زي خرزة. The diameter is about 1.4 millimeter with a length of about 3 to 6 millimeter. Okay, this is one of the products that are used for erectile dysfunction في الميل. اسمه Muse. طيب, now how to insert suppositories. طبعا the first thing you need to do is for rectal suppositories اللي هي first evacuate أو empty bowels, يعني empty the stool, evacuate the bowel. طيب, second thing is you need to wash your hand with soap and warm water. Then, after drying your hand, remove the suppository from its packaging, اللي سواء plastic or foil. Remove the suppository. Then, don't just go and insert the suppository directly. Lubricate the suppository so it will not be painful when it's inserted. So lubricate it either with small amount of jelly. If that's not available, just moisten it with little amount of water. Then you can do either one of two things. One, اللي هي stand with one leg while the other leg is on a chair. Okay, and then you can insert the suppository, or you can lay down on one side and straighten one leg. خلي واحدة من الأرجل straight while the other one is bent, and then you can insert the suppository. Now, طبعا when you want to insert the suppository, you need to separate the buttocks to expose the rectal area, and then gently but firmly push the suppository. For infant, as I already said, it should be half to 1 inch, and for adult it should be about 1 inch. After that, close the legs, okay, and sit still for 15 minutes. خلال at least 1 hour. Don't empty any stool. طيب, هنا خلونا let's talk about something. Avoid emptying for 1 hour, صح? And you already went to the toilet to empty bowels. Now, sometimes this will get exchanged. يعني you will not go to empty the stool, and after administering the suppository you will need to empty the stool. يعني بعكس the direction that I discussed here. When this will happen, it will happen when you already have constipation and you are not able to empty the stool, and you are administering the suppositories in order to be able to empty the stool. Okay? After you finish and lay down for 15 minutes, you need to wash your hands, and at the same time, don't go and exercise directly. You need to take some rest and be calm. Okay? I will show you a video regarding the use of suppositories. Please watch.
How to use suppositories. You are not alone if you're asking, what am I supposed to do with this thing? Inserting a suppository isn't pleasant, but it can be fairly painless if done properly. You will need hand soap, a towel, and a suppository. Always follow the directions from your pharmacist or the manufacturer when using medication to avoid serious health problems. Step 1. Use the restroom to empty your bowels and bladder if possible. Step 2. Wash your hands thoroughly with soap and dry with a towel. Step 3. Unwrap the suppository. Suppositories melt with body heat to allow for absorption into the bloodstream. Do not hold it in your hand for too long or it will begin to melt and will be unusable. Step 4. Squat or lie down on your side, bending one leg up and keeping the other leg straight out. Step 5. Insert the suppository, pointed end first, gently. Push until it is completely inserted and squeeze your legs and buttocks together. Suppositories may be inserted rectally, vaginally, or in the urethra, depending on their purpose. Be sure to read the directions to determine where your particular suppository should be inserted. Step 6. Wash your hands thoroughly. Step 7. Lie down and rest for up to 15 minutes to give the suppository time to be absorbed. Step 8. Wait to use the restroom for at least 1 hour after insertion. Did you know? Suppositories are generally made of an oil medium such as glycerin, cocoa butter, or vegetable oil, and
Of course, I have to say here, if you look at the video, it says that it can be made of oil material or oily material such as glycerin. Glycerin is not oily material. Glycerin is water soluble material, but maybe the touch is similar to oil. Yani if you feel it between your fingertips, it will be more or similar to oil, but it's not oil. It's actually water soluble or water miscible liquid.
mixed with medicine.
Okay, so let's continue. Regarding inserting vaginal suppositories, طبعا you can read it by yourself. It's straightforward and simple. There is no need to explain it in details. طبعا in the beginning you need to wash your hands by soap and warm water, and at the end also you need to do the same thing, اللي هي wash your hands with soap and warm water. The use of applicator. I will show you a video regarding the use of applicator, so please watch this video with me.
Hi, I'm Michelle. I'm a pharmacist here at Women's International Pharmacy, and I'm going to show you how to insert a suppository into the plastic applicator. When you receive your suppositories in the mail, you'll also receive an applicator. Before and after using this medication, it's very important that you wash your hands thoroughly. To remove the suppository from the wrapper, separate the two flaps and pull. Then, put the suppository into the applicator. The suppository is now ready to use. So I hope that helped. And remember, we have lots of information here on our website. And if you have any questions, please give us a call.
Okay. Now we want to talk about what are the factors that will affect drug absorption following rectal administration, because as we already explained, rectal administration may involve drug for local action or systemic action. أما بالurethral بالvaginal administration, especially vaginal administration, we do not intend to have a systemic action, because I said that that area is dynamically, physiologically and dynamically and anatomically dynamic. pH changes, permeability changes. That's why mainly here we are talking about rectal administration. So what is affecting the absorption of the drug for systemic effect? طبعا before we start talking, just for you to know that the surface area of the rectum is very small, يعني about 200 to 400 square centimeter, اللي هي بالسكوير متر بتطلع من 0.02 to 0.04. طبعا just to show you how small is this, the area or the alveolar region area اللي هي lungs, the lungs surface area is very big. It can be as big as tennis court. Okay, now about, let's say, 500, 600, 700 square meter. The small intestine alone is about 200 to 300 square meters. This is nothing. And small surface means the absorption is not really going to be that big because the surface area is small. The length of the rectum is about 15 centimeters or 150 millimeter and contains little fluid. Little fluid means there is no enough fluid to maybe dissolve the drug if it is in a large quantity. Now, the factors that affect drug absorption can be classified as physiological factor or physicochemical factors. Let me remind you here again that physiologic factor is to do with the rectum, while physicochemical factor is to do with the base and the drug. Starting with physiological factors, we will talk about three main things اللي هو الcolonic content, يعني what is inside the colon. Here I'm talking about the stool. Circulatory route اللي هي about the veins, hemorrhoidal veins, okay, that absorbs from the rectum, okay, and the pH and lacking of buffer capacity in the rectum. Okay, we will talk about each one in detail. Colonic content, as I said, here we are talking about the stool. Now, remember that we said before inserting the suppository, the patient needs to empty the bowel, evacuate the stool, or empty the stool. Now, there are different reasons for that. One reason is because drug absorption is much better when the rectum is empty compared when it's distended with fecal matter, يعني when it's full with stool. So the absorption becomes less in that case. Okay, that's why we need the patient to empty the stool. طبعا with the exception if the patient already has constipation, so he cannot empty the stool. Now, regarding the circulation route, طبعا all these are physiological factors. As I said, that the lower, inferior, middle hemorrhoidal veins, they will bypass the liver. They can take the drug directly into the systemic circulation. If you insert the suppository high up in the rectum, then in this case, absorption can happen by the superior vein. Now, the third thing اللي هي ايش؟ the pH والbuffer capacity in the rectum. Now, what do they have to do with the drug absorption? They have a lot to do. For example, let me give you just a simple example, okay? Now, if you are taking orally a weak basic drug, okay, يعني you are taking a weak basic drug orally. It goes to the stomach. Now the stomach is acidic and the drug is weak basic. What will happen? See what will happen. One, the drug will interact, or let's say will ionize in the stomach because of the acidic condition of the stomach. This will cause the drug to dissolve very quickly in the stomach. But again, and let me just draw something for you here. Okay, if you have, this is the membrane, let's say of the stomach or of the rectum, whatever, and here you have the drug. And in this place you have the systemic circulation. Now the drug, طبعا I will consider the drug is in the solution. تعتبر الدواء دايب, يعني it's molecules, because if they are solid particles they cannot get inside or through the membrane. So in this case, for the drug to get through into the blood inside, what has to happen? In order for the drug to be able to get easily through the membrane, the drug need to be in the unionized. هنا طبعا I'm writing U يعني unionized form. ليش? Because the membrane here, this membrane is lipid in nature. فif it is ionized, if it is ionized, then it will be difficult for the drug to get through the membrane. طيب. The other thing is, okay, but we know that for the drug to get or to be soluble to a large extent, then it needs to be in the ionized form. But if it is in the ionized form and soluble, then it will be difficult to get through the membrane. طيب, what affects the ionization and non-ionization? اللي بيأثر على هاي اللي هي 1 ال pH of the medium. Number 2 اللي هو the drug, the nature of the drug. Is it acidic or basic drug? But these two things will affect إذن its solubility. Also it will affect ionization, and it will affect therefore also the absorption. But it's a kind of complex thing. يعني for dissolution, then ionized is preferred. For absorption, non-ionized is preferred. That's why we need something in between. يعني at the end we need the drug to be soluble, one, and get absorbed. طيب. Now regarding the pH. What is the pH of the rectum? It's neutral. Neutral يعني about 7. Additionally, it has no effective buffer capacity. I believe either you took this one or you will take it in physical pharmacy, and maybe also حتى في analytical chemistry. Now, buffer capacity is talking about the ability of the buffer. I'm sure you know what is buffer. The ability of buffer to resist changes in pH upon the addition of small amount of weak base or weak acidic material. So it has no buffer capacity. It cannot control the pH. Also, the pH is neutral. فإذا it's all left to the to the drug and the base. معناته all left to physicochemical properties. معناته because the pH of the or the physiology or the pH of the rectum is neutral and has no buffer capacity, يعني this one has no effect. فضل الشغلة على على الدرug and the base, the formulation. Now, if I consider a drug that needs to be absorbed and the base is cacao butter, اللي هو oleogenous base, okay, if I use non-ionized, مش ionized, لا, if I use in this one non-ionized drug and then I insert this in the rectum, the suppository base will melt. The drug is in the cacao butter. Now the drug, because it's non-ionized, so it prefers the oil medium. والrectum الميديم تاعه aqueous, not oily. فإذا I have oil, I have rectum with an aqueous medium. يعني اللي جوا الrectum aqueous. ما بحكي على الممbrane here. I'm not talking about the membrane. I'm talking about the medium that surrounds the suppository. It's aqueous. And the drug, if it is non-ionized or unionized, then it prefers to stay in the cacao butter than leaving to the surrounding aqueous medium. معناته ايش؟ It will be difficult for the drug to get absorbed. طب in this case I prefer to use drug salt, يعني ionized form of the drug. ليش؟ So that it can leave the cacao butter base and get into the surrounding اللي هو ايش aqueous medium, and from there it can be absorbed. طبعا you will ask me, it's ionized, how it can be absorbed? طبعا when I say ionized, it doesn't mean when it dissolves it will be 100% ionized. لا, there will be maybe a small fraction non-ionized and large fraction ionized. Now when this gets absorbed, this gets less, بقل هذا نسبته صح؟ اوكي فشو بصير في الايونايزد؟ بصير part of the الايونايزد بتحول لايش؟ لنون ايونايزد in order to maintain same proportion. يعني اذا هذا 10%, this is 10%, this is 90%, this gets absorbed, so it becomes less, then this must associate or becomes unionized, okay, in order to keep the percentage 10%, 90% all the time, okay? So absorption will always be there, no matter what is the pH, because always there will be some unionized species موجودة existing, okay? طيب, in case I am using water miscible bases, زي مين؟ زي ال PEG polyethylene glycol أو الجليسرينيتد جيلاتين. In this case, I will be able to use ionized drug أو salt. Also, I can use the non-ionized. Why? Because this PEG or glycerinated gelatin will dissolve and it's water miscible. فبالتالي it will get mixed with the with the medium of the rectum اللي هو aqueous. It can mix with it. It's miscible with it. But of course, PEG and glycerinated gelatin, they take some time before they dissolve. طبعا this is a problem. So what I mean to say here, in the rectum, pH is neutral and it has no effective buffer capacity. فبالتالي it's all left to what? To the drug and the base. These are physicochemical properties and we will talk about them here. Okay? طيب طبعا here we are going to talk about the drug. من ناحية solubility تاعته, is it lipid soluble or water soluble? Is it ionized or non-ionized? Number 2, we will talk about the particle size of the drug. Number 3, we will talk about the base. Now, whether the base will melt or it will soften or it will dissolve. And is it hydrophilic, يعني water miscible, or hydrophobic character, يعني oleogenous. Okay, these are the things we will talk about. طيب, lipid water solubility, here I'm talking about the drug. طيب, remember that I'm talking about ايش? Factors affecting drug absorption. طيب, the drug, its lipid solubility, هل هو water ولا lipid؟ طبعا many drugs they have some solubility in oil or on lipid and some solubility in water. Some of the drug has much more solubility in water compared to lipid. Some drugs have much more solubility in lipid compared to water. Now we can measure that by what is called partition coefficient. Okay, partition coefficient measure how much a drug likes to be in oil compared to being in water. I will not talk about this in details because I think you will study about this in next semester or first semester in third year. But if the drug has more lipid solubility, would you prefer to put it in fatty suppository, or would you prefer to put it in water miscible suppository? Now, if you put it in fatty suppositories, then as I said previously in my previous explanation, that in this case the drug would prefer to stay in the base because the surrounding medium is aqueous and the drug is lipophilic. طيب, if it is also in low concentration, يعني أنا استخدمت, I used the lipophilic drug in the fatty base, والlipophilic drug is also in low concentration, معناته very little will be able to escape into surrounding aqueous medium. معناته in this case, if I have to use the lipophilic drug, I need to use it in large concentration in order for some drug to be able to escape from the oil. طيب, otherwise I can put it in water miscible vehicle, which can take both water soluble and oil soluble drug. Okay. The other thing is regarding the particle size. Now, many suppositories, we don't dissolve the drug in the base. We suspend the drug particles in the base. طيب, when the base melt or dissolve and the drug particles are there waiting to dissolve, their size will be very important in determining how much drug will dissolve in the rectum, and therefore how much drug will be absorbed from the rectum into the systemic circulation. طبعا, you already know this. The smaller the particle size, the larger the specific surface area, the faster is the dissolution, and therefore the faster is the expected absorption. Okay? So these things you should always understand them and remember them. Okay? إذن, if I want to control this factor, اللي هو physicochemical factor, اللي هو particle size, then I should use a drug with small particle size. The third factor, اللي هو the nature of the base. We already talked about oleogenous base and water miscible base. It's very important that the base does not inhibit the release of the drug, and also it's very important that it should not interact with the drug negatively. Also, it's very important that the base, okay, does not irritate the mucous membrane of the rectum. زي في الجليسرينيتد جيلاتين. Why? Because they may initiate colonic response. بتأثر الكولون. And when the colon is affected, شو بصير؟ بصير له irritation. بصير عندنا it will promote a bowel movement. وبالتالي بصير عندنا ايش؟ evacuation of the content of the rectum. بالتالي, therefore, I will lose the suppository and the drug before it can give any effect. Okay. So it's very important that there is no interaction between the drug and the base, whether chemical or physical, and also the base keeps the drug stable, okay, and it does not affect the bioavailability of the drug. Let's talk now about the suppository bases. We already discussed in several sections the importance the bases play in releasing the medication. Already we talked about this. Okay? For example, we said that the base will either melt, هذا في oleogenous bases, or swells. Okay? Swelling يعني هون it absorb اللي هو من aqueous medium, and it swells. والswelling allow the drug to be released زي الهيدروجels يعني. Okay? or dissolves زي PEG وglycerinated gelatin. طيب, and we talked about the oleogenous bases, that if you use them for hydrophobic يعني oily soluble drugs, then it will be difficult for the drug to be released from such base. We already talked about that. And we also talked about the condition when the rectum is inflamed or irritated. In this case, cacao butter appears to be superior compared to other bases لأنه oily very soothing to that area. So how do we classify suppository bases? Here let's remember that we talked about oleogenous bases, وفي عنا اللي هو الwater soluble or miscible bases, وفي عنا another one اللي هو third one. الثيرد اللي هو miscellaneous. اوكي بنحكي لها miscellaneous او others or miscellaneous. اوكي miscellaneous اللي هي others يعني. oleogenous base, these include اللي هو thiobromo oil, وحكينا الثيوبروما oil ايش the other name for it اللي هو الكاكاو باتر. وفي عنا اللي هو synthetic triglycerides oils. Okay. Thiobromo oil أو الكاكاو butter is the oldest base that has been used since very long time. It's the first and the oldest because it has so many good characteristics. For example, it is solid at temperature between 15 to 25, but when the temperature gets to between 30 to 35 degrees Celsius or above, such as in the body, then it melts and it's a bland, لطيف يعني, non-irritating oil. طيب, we are living in a warm climate or hot climate, and at 30 and above it melts. That's why in such climate you should refrigerate the suppository if it is made of cacao butter. طبعا cacao butter or thiobromo oil has certain disadvantages. Okay, has certain disadvantages. The two main disadvantages that I will talk about now اللي هم one, if you want to prepare suppositories made of cacao butter, then the usual way we do it is by melting the base اللي هو الكاكاو butter, melting it يعني elevating the heat to melt the cacao butter, and then we dissolve or disperse the drug in this liquid. And then we take this hot liquid or warm liquid, let's say warm liquid, we take it and we pour it into suppository mold. For suppository mold, it will solidify, it cools down and solidify, and then we can take the suppositories out from the mold. What is the problem here? The problem is when you heat the cacao butter above 35 degrees Celsius, you will have a metastable cacao butter. يعني cacao butter is a polymorph material. يعني is present in different crystalline structures or crystalline lattice. And if you heat it above 35, then you will get to a metastable base. This metastable base will melt at temperature between 25 to 30 degrees Celsius. يعني it's very possible that at room temperature it melts. And this is not correct or not right. That's why you should not exceed 35 degrees Celsius when you melt cacao butter. The other thing about the cacao butter, with some materials, with some drugs like chloral hydrate, the melting point will decrease with chloral hydrate اللي هو sedative or hypnotic drug. وكمان another example is phenol. They will decrease the melting point. This is again a problem similar to previous problem. Okay? And in order to circumvent this problem, we need to add a solidifying material. Okay, يعني if I need to use chloral hydrate or phenol اللي هو antiseptic الفينول with cacao butter, I will have a problem. شو البروبلم؟ إنه the melting point will not be between 30 to 35, it will decrease. How to solve this problem? I can add a solidifying agent, such as what? Such as spermaceti or beeswax. They can raise the melting point again for the finished suppositories to the desired range. Nowadays, because so many developments have happened since a very long time when cacao butter was used, now they are using synthetic triglycerides اللي هي عبارة عن مهدرجة يعني hydrogenated vegetable oils. Why they use hydrogenated vegetable oils? Why not vegetable oils? Because hydrogenated vegetable oils will be more solid. أما vegetable oil بيكون liquid. The good thing about the hydrogenated vegetable oil اللي هي stability. It doesn't exist as polymorphs like cacao butter. No, it's stable. Even if you heat it to high degrees, it's stable and has good characteristic. Example عليهم اللي هي triglycerides from palm kernel and coconut oils كexample من synthetic triglycerides. Okay. The second section that we want to talk about اللي هو water soluble أو miscible vehicle. We will talk about glycerinated gelatin, number one. Then we will talk about polyethylene glycol. Then we will talk about soap glycerine. Glycerinated gelatin. From the title, glycerinated gelatin, you should know the composition. The composition is glycerine and gelatin. Now, such suppositories are particularly useful في الvaginal administration مش بالrectal. For rectal administration, such suppositories will be used mainly as laxative. لأنه الجليسرين is known to increase the osmotic pressure في الrectum and also to irritate the rectum, and this will help to defecate. Okay? That's why it's mainly used for vaginal administration of drugs. The good thing about glycerinated gelatin that it's compatible with wide range of medications. It's able to dissolve and disperse slowly in mucus secretions, and this can provide a release of the drug over longer period of times. Okay. In case I want the suppository to be stronger, okay, I can increase the amount of gelatin اللي هو solid مقارنة in comparison to glycerine. Okay. Now the problem with this suppository اللي هو الجليسرين. Glycerine is known to be hygroscopic. It loves water. It takes water. Whenever there is water, it absorbs water. Okay. فبالتالي that's why you need to keep it in airtight container and in a cool place. And again, I want you to know that these terms are important. When I say airtight, what does it mean? It should not allow air in or out. Okay. فما بالك الدست والother particles. طبعا it's very tight. Okay. Very tight من ناحية ايش؟ when I say air, very tight, I mean here not really you close the container so tight. No, it means that it doesn't allow the air in or out. Because it can absorb, as I said, atmospheric moisture. And this can cause even contamination. Because when there is water, you have microorganisms. That's why also in order to extend the shelf life of the suppositories عشان نخليها تكون دائمة فترة أطول مش 1 month or 2 months, I can usually it's a preservative is added. يعني بضيف مادة حافظة. A preservative is added في ال constituents تاعت ال glycerinated gelatin suppositories such as methyl parabens والبروبايل بارابينز كcombination مع بعض or individually with the glycerinated gelatin. Before administering the glycerinated gelatin, they should be dipped in water just before use to facilitate الانسرشن. طيب usually glycerinated gelatin contains شوفوا glycerine 70%, gelatin 20%. طبعا الجيلاتين هون يا اما جيلاتين A or جيلاتين B or a combination of both. فارماجيل يعني جيلاتين A or جيلاتين فارماجيل A او فارماجيل B. يعني زي كأنه جيلاتين A او جيلاتين B. You already know the difference between gelatin A and B. So 70% glycerine, 20% gelatin, and 10% is a drug dissolved or dispersed in water. We mix them together, heat them, and then pour them in a mold. Okay. طيب. Just for you to know, glycerinated gelatin اللي هي which they use for constipation. يعني if you go to the pharmacy and you ask the pharmacist, I want a glycerine suppositories, then they will give you a suppository consisting of 70% glycerine. Okay, بيكون فيها 70% glycerine, such suppositories. Okay, that's why when I said it's mainly used for vaginal administration, the reason was إيش؟ إنه it can cause defecation. عشان هيك if I want to use rectal suppository for constipation, then in this case I can use glycerinated gelatin. طيب the other polymer that have received a lot of attention lately اللي هو ال PEG أو ال polyethylene glycol polymer. if we go to polyethylene glycol polymer, you will see that it's available in different molecular weight. في عندنا 4000 4000 6000 1540 etc. We have different molecular weight. طبعا as you go up في molecular weight it becomes harder and stronger and the melting point gets higher. Okay, that's why we use PEG with a melting point higher than the room temperature, maybe let's say 40 or 50 degrees. And if we do that, then we can easily store such suppository at room temperature. مش زي الكاكاو باتر. شوفوا الكاكاو باتر, no, it's better to store it in the refrigerator. But for such suppositories, I am able to produce them with a melting point higher than room temperature. طيب, question: can I use just one PEG? Why do I need to mix more than one? As you see here, we have mixtures of PEGs. The answer, yes, I can use one PEG, but normally we use combination of 2 or more PEGs in order to get the desirable property in terms of واحد melting point, number 2 اللي هو drug release or the dissolution or dissolving of PEG. That's why we use usually combination, even though we can use just one. طيب, you will see here the name macrogol. Macrogol is the same as PEG. It's the same thing, but in different countries they call PEG a different thing. In some countries they call it macrogol, I think in Germany and Europe, and PEG in some other countries. Okay. طيب, let's get back to the PEG. We said it received many attention recently. Why? The reason is it has some desirable properties. طب شو هي desirable properties؟ إنه one, it's chemically stable. يعني بالهواء, in air, it doesn't absorb moisture, it doesn't oxidize, it's stable. 2, it's non-irritating, it doesn't irritate the rectum. 3, it's miscible with water and mucus secretion. 4, اللي هي it can be prepared by the common method اللي هو molding, and even the not very common method اللي هو compression. It can be prepared by both, as I told you, with a range of hardness and melting point. Okay. The other suppository اللي هو ايش is soap glycerine. Soap glycerine was at a certain time was popular, but nowadays you seldom see them. Why you seldom see them? يعني you rarely see them because they are very, very hygroscopic. يعني it's difficult to prevent them from absorbing moisture. So keeping them is a challenging task to preserve them and to keep them. طيب, what do they contain? They contain glycerine and soap. طب شو الجليسرين؟ قديش الكونتنت اوف جليسرين؟ الصوب طبعا صابونه يعني انا بحكيهم. Okay, like soap. What is the content of glycerine? It can be up to 95%, which is very high. Okay, إذا قديش نسبة الصوب؟ About 5%. طب الصوب, what is this soap? What is it? What is the component of this soap? It's sodium stearate. ايش؟ صوديوم stearate. إذا طيب, هذا الصوديوم stearate اللي هو الصوب comes from where? From the interaction of sodium carbonate with stearic acid in very similar way to preparing soap. Okay, so we prepare sodium stearate from the interaction between sodium carbonate and stearic acid, and then we add glycerine and allow it to solidify as it cools down. Okay. But why? What is this used for? What drugs do we put in? We don't put any drug. Soap glycerine itself was used as laxative. ليش؟ لأنه في glycerine. And glycerine, what does glycerine do? It حكينا بيسوي osmotic effect غير irritation, other also than irritation as well, and this will cause evacuation of the bowel. طيب, D here is referred to as hydrogels. Now hydrogels actually belongs to others or miscellaneous because they do not intend to dissolve. They are not water miscible or soluble. It's not that intention. The intention here, or what they do actually, is that they swell, يعني بينتفخوا. طيب, these are macromolecular network of materials, can be polymers. Okay, لأنه macromolecular network, macromolecular يعني molecule كبير. They swell because they absorb, they get water because they have some hydrophilic functional group. يعني in their structure في بعض الجروبس hydrophilic موجود في الستراكشر. فشو بسوي؟ This hydrophilic will attract water to come in. When water gets in, when water gets into the hydrogel, and the drug is inside the hydrogel, what will happen? Water gets in and drug gets out. So how much water can get in? How fast is the drug getting out? يعني the faster the water gets in, يعني the more hydrophilic groups are there في الهيدروجel, the faster the water gets in, and this will allow the drug to dissolve and get released. ليش it will get released? Because when the drug dissolves بصير عندنا تركيز عالي, we will have high concentration of the drug in the hydrogel, and outside the hydrogel the concentration of the drug low. فبصير عندنا diffusion, the drug gets from the high concentration to the low concentration, and this is how the drug gets out. Examples, we have the polyvinyl alcohol, hydroxy ethyl methacrylate, we have polyacrylic acid, and we have also polyoxyethylene. Okay, we will stop here, and inshallah in next video we will complete the topic اللي هو suppositories. I hope you understood whatever I explained in this video, and as usual you can come to my office. You have the WhatsApp group and you have my email, and also in the class I'm available for any question. Thank you for listening, and goodbye.